Here very ably represented by our own professor of no man in Nigeria, a doctor of health in Nigeria, Senator Calabar. Well, Your Excellency, before we go ahead, we would like to hand over to you.
It's a brand new former general the team event.
Yes.
It's not a solo event.
Yes.
So we are all, including the laborers in the vineyard of health. And that is why we're here to also be part of this. And thank you for what you've been able to do thus far. Okay.
Yes.
Thank you very much. So, to the glory of God and for the benefit of humanity, particularly the people of Cross River State that will be benefiting from this facility, I cut this tape to declare this place commission. In the name of the Father, and of the Son, and of the Holy Spirit.
Amen. So welcome, Your Excellency and Senator Calabar to the General Hospital. This is the reception of the General Hospital, and of course we're going to take their numbers, and then they can sit down, and when they are done, we go in for triage.
Hey, Dan.
Patients directly opposite them at the doctor's room, and of course they have their own dedicated. We also have a doctor's room so that the doctor of call can be just 4 hours. So this is actually the emergency theater. So when we have emergency cases, we need to just quickly do some.
Came here with a friend very late in the night, and it was an emergency. So reaching here, we had to discuss. I was looking for someone to assist us and looking for the nurse or something. Everyone was inside. People were struggling. I had to excuse people. Please, can you shift? Let me pass. It wasn't a nice experience, seriously. And we had to leave to a different hospital because we couldn't even get someone to attend to us. It was something else. I am very shocked at what I'm seeing inside. Everything is just a different standard right now, and I think the state government is really doing their best right now.
Okay, I actually, I've been here for some time, some years now. In fact, the state of this hospital was so down, and most of it, we were not even having patients here. But In fact, if you look at the hospital now, it's quite so nice, and the renovation, and if you even go right inside there, you see the facilities and all that. It's so wonderful, and we are hoping that, I think, with what the presence of the hospital now, more patients will come in, and and a lot of medical services will be offered to the masses.
Basically, what you can see here is a 360 turnaround, a complete transformation that happened under His Excellency Senator Professor Ben Ayade. This transformation took less than 3 months in spite of the COVID to happen. What we met here was a lot of dirt, bad spoiled equipment, old furnitures, and the rest of it, the floor unkept, people sleeping on the floor and hanging out all around here. And the governor said that was unacceptable, and he wants to be able to deliver first-class healthcare delivery to Cross Riverians from this facility and all other general hospitals in Cross River State. And so we went to work, and today we have a brand new reception. There was no reception before in this hospital. And then we have the outpatients, very new consulting room, standard, a standard pharmacy and a store. We have a new casualty for emergency cases with all the equipment that should be there. We also have a theater, an emergency accident and emergency theater, all refurbished, everything new, upgraded to a 21st century health facility where we can deliver quality health care to people. Remember that the governor is starting full implementation of the state health insurance scheme in Cross River State. And part of the requirements by His Excellency to begin that scheme was the fact that the hospitals must be upgraded up to speed. We must have the right manpower skill, and at the same time, we would be building their capacity to offer services to people. Beyond this hospital is a flagship hospital in Cross River State. It serves the population, it serves those from neighboring states, it serves those from neighboring countries, and that's why we had to upgrade it to bring it up to speed. We need to put our best foot forward, and we're happy, we're proud of what the hospital looks like today. We must very well thank His Excellency Senator Professor Ben Ayade for the wonderful work which he has been able to do in the General Hospital Calabar. So basically, every new day would be a step forward for the health sector in Cross River State. We want to be able to meet the health needs of Cross Riverians where they are. So we're not only working on the general hospitals across the state, we're also working on the primary health care centers to revitalize them, to refurbish them. We're also working on employing more health workers into the system. We're working on also, of course, training these health workers to be able to offer specialized care to those who need this care. And so Cross Riverians should expect the very best. We're just starting. By the time His Excellency Senator Professor Ben Ayade is done with his tenure as governor of Cross River State, we should have no general hospital that doesn't meet the highest standard that can be compared to any general hospital in Nigeria or outside the country.
Happily enough, it was an opportunity for me to also hear through His Excellency, the Deputy Governor of Cross River State, the devastation also visited on some of the health institutions here belonging to the state. And it's quite unfortunate, to say the least. But then, it's also an opportunity for me, as afforded me by His Excellency, the Governor of Cross River State, Professor Ben Ayade, to be here at this General Hospital to commission the rehabilitated and refurbished and renovated outpatient area of the hospital. And I've seen things myself coming in here. Like I said during the commissioning, you may even want to feel sick so that you can enjoy the ambience of the place. But talking seriously, for me, it's a testimony to the commitment of the government of Cross River State to the health care of the people of the state. And particularly at this level of general hospital, which is like a link between the primary healthcare and the tertiary. So it's the general hospital that links the two. And it's very, very important because most of the ailments that we see in healthcare delivery, the ailments can be managed at the level of the primary and the secondary level. Those two levels are very critical. And of course, it's also in a bid and quest to really achieve the universal health coverage, which is the in thing that every government wants to achieve. So I've gone in here myself, I've seen things myself, the outpatient area, the doctor's offices, the patient's waiting room, the emergency surgery area, and all that. So I'm convinced that the government of Cross River State, is, at least from what I've seen, really means well for the people. And I understand that the state health insurance scheme is it's in the works, and that will go a long way to really enhancing healthcare delivery of people of the state. So mine is to just appreciate the government of Cross River State for giving the opportunity, the honor, the privilege to do this commissioning, because it will be in history. You can't erase that. I came in to commission this place, isn't it? Your Excellency, thank you very much, because you are also part of the whole thing. And the Honorable Commissioner of Health, Dr. Bita Edu, for what the team is doing in the state regarding healthcare delivery. Thank you.